All right, started my recording. Hello, everyone. My name is Farhan. I am a third-year medical student. It feels weird to say now, but third-year osteopathic medical student, and today I'm going to be talking about a medical student's guide for a second year on how to approach boards prep. This isn't just going to be a regular board prep presentation. It'll have like strategies, resources, and some more things that I learned along the way, like more mindset things, and this is going to be both comprehensive for level 1 and step 1. For the most part, I tried to be unbiased on all the resources. I definitely talk about the ones that I use personally and the ones that I think worked versus didn't work, but this is just going to be an overview about everything. First off, wait, is it not going to the next slide? There you go. So this is our to-do list. It's going to be just basically what is boards, all the resources they have for boards, the general timeline, and other resources. I have some fun little quotes over here. They're all actually in the first aid book, so if you're actually going to the first aid book, you'll see all these little fun quotes. First off, all of you guys, welcome to the second year of medical school. You guys have successfully made it from the first year, and you guys are 1/4 of the way to being doctors. And I will let you know that this year will go by very, very, very quickly. Second year went so much faster than first year. It gets a little nicer for the school that we go to because we go to 4-day weeks and we have a 12-week dedicated period. Once anatomy ends, life gets better. So you stick it out for a couple more months and you guys will be happy for the rest of your lives, subjectively. Obviously, I have to put a disclaimer here that there's no method that is guaranteed to pass. This was simply the method that I ended up using, plus some other resources. And this is going through research, seeing what works, what doesn't work for other people, browsing Reddit, browsing like those random YouTube videos that are like, how I made a 260 plus on step 2, all those videos and like all the stuff like that. And also, I'm not affiliated with the medical school in which I attend, and then all views are my own. All right, so let's talk about what are boards, just to have a comprehensive review of everything. Here, we will talk about USMLE Step 1 and COMLEX Level 1. These will be things that you refer to as Step 1 or Level 1, all the same thing. And these are the national board exams required for medical licensure. For DOs, it's COMLEX Level 1. For MDs, it's USMLE Step 1. You will notice that a lot of DOs will end up taking USMLE Step 1. This reason is because a lot of clinical rotations, whenever you're applying for your audition rotations, some of them require specifically a Step 1 score. So it's useful to have it. It's kind of a gray area because a lot of people argue that if a rotation or a hospital requires you to have a Step 1 score, that they're not as DO friendly. And why would you go to a school that doesn't want you, right? So there's two schools of thought, and then also Step 1 is basically the same as COMLEX Level 1, except COMLEX Level 1 has osteopathic manipulative medicine, or OMM in this case. These exams function to assess foundational medical knowledge essential for clinical years. I don't know if you've opened or even looked at your first aid textbook yet. It's a big book. And it sounds crazy to say, but by the end of your dedicated, when you sit for your board exam, you will have a lot of that in your brain. You will know a lot of your first aid book. You'll be able to open a random page and know exactly what that thing is talking about with all the context, with all the things, because you've done all of your preparation beforehand. In terms of timing, this is typically taking at the end of your second year of medical school. I just took mine about a month ago, and that's basically it. Everyone's going to end up taking it. For our specific medical school, you need to have sat for the board exam, in this case the COMLEX, before you start clinical rotations, and you must have passed a board exam before January of the next year. So you guys are starting clinical rotations in 2026. So by December 31st, 2026, you have to have passed a board exam. In my case, you have to have sat by one before July 21st, 2025, which doesn't mean you only have to sat for the board and taken it. It doesn't mean you have to have passed it. But if you don't pass your board exam, they basically, pull you out of clinicals and all that kind of stuff. In terms of importance, the big change that happened about 4 years ago is that Step 1 and Level 1 are now pass-fail examinations. This shifts the focus towards mastering more core concepts rather than chasing a numeric score. Back in the day, everyone just memorized everything. I have one of my old doctors, like first aid books, and that thing is written all over everything. And now that it's pass fail, you generally put more focus into like learning the concepts, understanding the concepts, and testing yourself on these concepts, where you're not trying to be very perfect. So in this case, level 1, which is COMLEX level 1, just has the OMM specific component. If you break down the blueprints between step 1 and level 1, it's all basically the same, except the level 1 includes like more physical exam stuff and OMM. For unique aspects of COMLEX, same thing. Systems-based integration of clinical science in this case is like using, I don't know if you've ever seen your practice questions that has like a random viscerosomatic or a random like thing inside of it, inside of a medical question. So those are like integrated OMM with medicine. And that's exactly how COMLEX is as well. You'll see a full, like, let's say congestive heart failure question, and they'll give you like a viscerosomatic reflex. So those questions obviously don't show up on the MD USMLE ones because they just don't talk about OMM, right? There's no viscerosomatics in STEP, there's no Chapman points in STEP, there's none of that. So going into what you need for your arsenal, this is basically what board prep looks like. You need a physiology review, a pathology review, a microbiology review, a pharmacology review, and question banks. You can do 1 or 2 question banks. TrueLearn has about 2,900 questions, and uWorld has about 32 or 38, I can't remember, 100 questions. AMBOSS is something I didn't use, but a lot of people recommend it because of the explanations, because of the context, because of the articles that AMBOSS provides, and I'll be talking about those a little bit later. So if you want to make like a blank sheet of paper or something and be like, these are the things that I need, and then you find your resources that you have for this, you will be golden. Going to boards by resources, this is basically everything that is good. I don't know how else to say that, but for the most part, these are the most used resources. These are the most praised upon, and these are the resources that the people who passed these board exams use the most. In textbooks, we all know the first aid for USMLE. It's like a 750-page textbook that has basically everything in it. It is a comprehensive review, and it has everything from pathology, physiology, embryology, anatomy, all the way down to pharmacology. So I like to use this as a reference guide. I'll talk more about it later. Pathoma. This is a comprehensive pathology review, or it's a high yield pathology review. It is not comprehensive, but I will say if you understand Pathoma, for the most part, you won't miss many pathology questions. And then for the OMM peeps, we have the Savarese OMT review. This is the book that's like slide 2 at every single OMM PowerPoint that we don't ever look at. And it's not a textbook that I personally use, but I definitely use the cards that are associated with this textbook, which I'll talk more about later. Other resources are the video memory hooks. There is Sketchy Microbiology, Sketchy Pharmacology. Sketchy has a lot of other subjects inside of its SketchyMedical scope. They have like Sketchy Pathology, they have Sketchy Immunology, Sketchy Biochemistry, and stuff like that. The ones that I found the most useful for learning with Sketchy, like the picture platform and stuff like that, which I'll talk about later, are Sketchy Micro and Sketchy Form. Other useful third-party resources are Boards and Beyond, the AnKing deck. I don't know if you guys are using Anki or not. I had to talk about this about a year ago. I'll link the YouTube for it again as well. And that's just a active repetition, active learning resource to learn your medical school content. And then another resource I use is the Mehlman High Yield Arrows deck. It is a 130 card Anki deck that you can download. I'll also link it below in the resources. And basically that's just a physiology deck that tells you basically the arrows that are associated with aberrances of any disease. I'll talk about it a little bit later. Other things that we have for resources are question banks. You should be doing tons and tons and tons of practice problems. I actually did the calculation earlier, and I think I ended up, after my question banks and after all of my practice exams, I ended up doing about 11,000 practice questions, which is insane. But you'll see a little bit of it later. And testing resources. This is the NBME, which are also called the CBSE exams. And then we have the NBOME exams, which are also called the COMSAEs. The NBOME makes a secondary exam, also called the WelCOM exams. I'll talk about them a little bit later. But these are testing resources to test your knowledge and how you are kind of progressing, and if you're understanding or just memorizing your deficits in certain areas versus what you should not be studying, things that you're strong in. We'll just go into specific resources. I'm just going to break this whole list down, and we'll talk about each single one of them. First off, for the textbooks, USMLE Step 1 is the gold standard high-yield review book. It has literally everything you want in it, and I personally recommend not reading it from cover to cover. I know a lot of people will literally open it, and in 1 week they'll read all of cardiology. The next week they'll read all of, GI. I think it's okay to do that, but it's a waste of a lot of your time. There's going to be topics that you're strong in, there's going to be topics that you're weak in. And kind of, if you're going for like the perfectionist mentality, this is going to be a lot of waste of your time, because you're going to end up getting stuck on nitty-gritty information that might not even be tested. So if you're spending a lot of time understanding, let's say, a very niche GI topic like a diverticulum or something like that, and you find out that there's only like 3 questions on TrueLearn about it, use the practice questions to learn instead of shoving your head into the first aid textbook and trying to figure everything out. The way I used this book was I literally did not touch it until I started doing practice questions. And for my practice exams, when I was reviewing them, I would go back into the textbook and highlight the topics that I missed. So going on to missed questions, let's say I took NBME 29 and I missed a question on cardiology embryology. Let's say like tetralogy of flow or something like that. I would go into the book, I'd look at tetralogy of flow, I'd highlight, I'd look at what I missed, and then I'll talk a little bit more about how to review missed questions, but that's basically what I use. And then I had a visual guideline on what topics I was missing and what topics I wasn't missing. So coming into like the last couple of months of my board prep, I would just flip through the textbook and be like, oh, I don't need to learn this because I knew it and I got the question right. At the end of the day, you're trying to get the most amount of questions right? So there's no need in studying things that will never show up. And as you do more practice questions and see more topics and study more, you'll realize what things actually show up on the board exams versus things that never show up on the board exams. This little comprehensive thing. This is a guide that is posted by the USMLE Step 1. It's actually in the back, or actually might be in the front of your USMLE Step 1 book or first aid book. And it basically goes over every resource. I have it linked at the bottom of my references. And basically it categorizes every resource that's available per resource. Like let's say comprehensive review, pathology review, microbiology review, pharmacology review, and it kind of gives it a letter grade. And I like using this because it really consolidates what resources are good versus what resources are bad. And you definitely don't need all these resources. This is a guide on what you could be using. I ended up using, certain parts of some resources, and then I used some resources in their entirety, like SketchyMedical, SketchyPharm, Pathoma. I read the entire book. I annotated the entire book. I watched every single video. I did all the cards on those. But for Step 1, I think the only thing I actually read out of this book for content was like the public health stuff or the epidemiology stuff. And like for boards and beyond, the only thing I used it for was physiology because I didn't understand like some of the renal physiology. So I'll go on later and talk about what I specifically used, but make sure you know that this is a very modular study strategy. You need to come up with your own strategy on what to come up with, and I have some resources for you as well on how to create a schedule, what resources to use and stuff like that. Going on, we have the next book, which is Pathoma, The Fundamentals of Pathology. If you're not already using this book, you need to be using this book. It's a super cheap resource. The videos are really awesome. I think that this book is like a must-have. Like Dr. Sattar is very, very, very good on how to explain things. His videos are really, really good. And then I think that without this book, like I would not have understood anything. And pathology, of course, is one of the highest tested topics on COMLEX and STEP. Pathology and then normal physiology. Those are the two biggest things, along with reproductive in your systems. Reproductive is the highest tested system, and pathology and physiology or pathophysiology are two of the highest tested subjects. This one got an A+ rating. If you look, the first aid didn't even get an A+ rating. So this should tell you how well, and this is first aid's resource right here that come up with like their reviews things and all this stuff. So I definitely recommend this. If you don't like using this, I really think you need to find another like good comprehensive resource for pathology. Goldjohn's medical textbook is a really good one. Those are like video lectures and podcasts and stuff like that. And then Divine Intervention podcast. Those are just the guy that just, talks through pathology concepts and stuff like that. And if you're more of a listener and you can write notes and stuff like that, that's better. But I need a video, so I think Dr. Satar's on Pathoma's videos are just best. He finds a weird way to explain it, and it all makes sense to me. Last textbook is going to be the Savarese textbook. You will never buy this textbook. You will never open this textbook. So I will have a little note right here that says DO schools generally do a good job at teaching OMT in-house, and it's not really a needed resource, but it's good for supplemental information. I will say that I downloaded an AnKing deck, or an Anki deck, which is the OMM Demeter deck, and I just basically unsuspended all the cards that someone made off of this entire textbook. And I did those cards, and it made OMM super duper easy, and I honestly don't think I missed a single OMM question on my board exams. Like they're very easy once you finally kind of get a good review of everything, and you guys will get a comprehensive OMM review in block 8 prior to your dedicated. So honestly, I think like that review plus doing some cards and kind of brushing up on your weak topics is all you need for OMM. And there's a lot of OMM on the COMLEX. So these are easy points, and these are not questions that you should be missing, like at all. And I will say the OMM on the actual boards is way easier than the OMM that we have in our in-house exams. Way easier. Our professors find a way to make everything hard, and it is not that hard. Going on to third-party resources, I already talked a little bit about SketchyMedical. The two resources that I recommend from this is Sketchy Microbiology, which is a comprehensive high-yield review of every single bug, and then Sketchy Pharmacology, which is also a comprehensive high-yield review of every drug. This is a lot. There is a lot of bugs, and there are even more drugs. And one of the recommendations that I'd make is that I want you to please use this resources even if you hate it. I know it sounds really hard, but I don't think that there is another comprehensive review for microbiology or pharmacology that covers every topic on our board exams. Even if you don't watch the videos, I think that do the cards. I think that you should find the PDFs or something and go through those, but even if you hate it, I think that you should be using these things. Even if you hate watching the videos, put them on 2x speed, grab all the information that you need. I know a lot of people don't like hearing that, but there is no other resources that I found adequate for teaching microbiology and pharmacology. First aid is a good resource, but even first aid misses a lot of things that kind of group bugs together in the way that it's presented on first aid. At the beginning of first aid, there's a microbiology chapter, and then in between every system, there is a pharmacology for that system. First aid does a really bad job of putting the microbiology and the pharmacology for each bug together, and I think that is the way you should learn it, and Sketchy Micro and Pharm do that the best. So even if you don't like it, use it as a break. Watch the video. They're super short for the most part. I think that like the beginning of Sketchy Micro, all the bugs are like 8-ish minutes long, and I think the longest bug is probably like 14 minutes long. Pharmacology, on the other hand, they're mostly short, except for like 10 or 15 long ones. The aspirin one is like 30 minutes. The COX inhibitors one is like 30 minutes. Some of the hematology stuff is like 30 minutes as well, but it also covers a lot of physiology, which for the most part, if you understand where the drug is used in physiology, it helps you understand the physiology as well. So why we use, proton pump inhibitors to treat gastric acid and stuff like that. So understanding why we use those medications helps you understand the whole pathway of what happens in the GI system, for example. And then I have some random quote. If you like it, do it. If you hate it, do it anyways. I made that up. I wrote some random thing about it. Another third-party resource is the AnKing medical deck. This is a pre-made Anki deck that integrates first aid, Pathoma, and Sketchy. If you want more information on this deck, I made a 1-hour video on everything about it. It was a review for OMS 1s and OMS 2s, so if you want to send this to your littles and stuff like that who are coming into medical school, it'll be a good resource for them. And then for you guys who have already done first year, there's a good portion on second year that I think that everyone should watch, and just kind of reiterate some points that I'm bringing here, but also showing you how to set up Anki, how to use it, how to kind of go about it. It's a fully integrated lecture, and it's pretty good, I think. No bias there. The AnKing deck, for those of y'all who don't use Anki, it is best for active learning. I think that active learning is kind of hard to do, but it is the most rewarding thing to do. I think reading is very passive, and writing notes can also be very passive, because I can type pretty fast and I can type very brainless. I can type things out and not even think about what I'm typing. When I write things down, I slow down a little bit, but I'm still not as active as doing it. And I think using Anki and stuff like that, where information just flashes on your screen and you have to recall it within a certain time period, I think that helps you the most with active learning. It does take some time and it does require consistency, which I talk about more on my Anki overview, but I definitely think that this resource really took me to the other side. Like, I really streamlined how I was studying. I really minimized all the time I was spending studying. During dedicated, I would wake up, I'd do my practice questions for, let's say, about 3 or 4 hours. I'd review them. I'd do my Anki, and I'd be done by like 3 or 4 o'clock every single day during dedicated, like 8 to 4 every single day. And other things are just stay consistent and then suspend cards that you don't need. I'll talk about this a little bit in my Anki my Anki presentation, but you shouldn't be doing things that you don't need Anki cards for. Anki is a learning resource. You don't need it for basic information. You don't need it for basic stuff, and you're going to waste a lot of your time doing it. So if you find things, let's say like you're worried about staph aureus, you don't need a card that says staph aureus is gram-positive. Like, you don't need it. Like, you know that is something that you've seen 100 times. And at the end of the day, if you think you can get a question right on that topic, you don't need the card. Because at the end of the day, you need to get the most amount of questions right. So you come over here, you see what things you are, some of the cards you might need for, let's say, staph aureus is like, what is the most common, infection, like osteomyelitis. You'll know that it's like salmonella, it's staph aureus, it's staph epidermidis, and stuff like that. Those are the questions you need, because those are the harder practice questions, or questions that will show up on your boards. So keep the things that you need for getting the most amount of questions right. If you think you can get a question right on it, suspend it. Don't look at it. If you get it wrong, that's okay. Go back and unsuspend it, because you got a question wrong on it. You don't lose out on much. You also got the learning experience, and you get to put it into your cycle of cards to learn. I will say that I only did cards on SketchyMicro, SketchyFarm, and Pathoma. My physiology was okay. Like, for the most part, it was good. I didn't need like Anki cards for it. I just needed another review during dedicated for it. So I watched all the boards and beyond. I took notes on every single lecture, and that was enough for me to understand all the physiology again. For AnKing, the Pathoma deck, the SketchyMicro deck, and the SketchyFarm deck together comprise about 15,000 cards. And having that in your arsenal, doing it over a 1 year period, I was probably doing like 300 cards a day, which is not much. And one of the cool things that you guys can do now as second years is you can start doing Anki cards, practice questions, and sketchy videos and stuff like that with the systems that you're learning. So as you guys are going into GI and renal, you can start watching all the GI Pathoma videos, do all the GI Pathoma cards. When you have your CBL on GI bugs, go watch all those GI bugs in Sketchy, do the cards on them. That way you're studying for your in-house exams and you're studying for boards at the same time, and you're not doing extra work, right? Because at the end of the day, there's a lot of information for med school and there's not enough time to learn it. So you really need to be streamlining your studying, and you need to be not doing twice the amount of work. So always have it in the back of your mind of, if I'm studying for my in-house exam, how can I also be board prepping? This is obviously a privilege scenario, because if you're not doing well in your classes, you should not be board prepping on top of it. Like, you need to focus on passing your classes and stuff like that. If you find that studying for boards on top of studying for your in-house exams is too much, drop it. Once you finish anatomy and physiology, you go to 4-day weeks. You can dedicate one whole day to doing board prep, catching up, doing all that stuff. So it gets a little easier, but remember that your grades come first, and passing your classes is more important than board prepping and stuff before you get to dedicated. Other resources are Boards and Beyond. In this case, I used it for physiology, but Dr. Jason Ryan has really good, basically every single video on every single topic. Anything from embryology to anatomy to physiology to pharmacology, he has stuff like that. And the way his videos are integrated, they're pretty good. And one of the things that I liked is that his videos really correlated with how the first aid book reads. So if you watch the first video on Boards and Beyond, it's likely the first subject on the first aid for that chapter. And you'll notice that like sometimes the sentences on the Boards and Beyond are literally from the first aid. And you can follow along as you do it. If you need a writing resource, if you're not just going to take notes in a notebook, you can write on your first aid and kind of do that. I took the route of writing it down on a notebook so I can reference it over and over and over again. But I think that using first aid as a supplemental resource while you're watching the videos is a really good way to stay active in your learning, because it's really easy to just put on a video and like turn your brain off, right? So if you're actively taking notes, or if you're actively reading with the first aid book and taking notes and drawing diagrams and stuff like that with it, it'll help it stick a lot better. For this one, I used it just for physiology. I don't think I used Boards and Beyond for anything else. Physiology, and then I used it for vitamins for biochemistry, because vitamins are very high yield for the COMLEX. You know how we go for non-pharmacological options, so staying up to date with vitamins, finding out how vitamin deficiencies affect and how they present as pathophysiology, like those are really, really, really high yield topics, and I wanted a comprehensive review of that, and I found Boards and Beyond to be the best resource for that. Other third-party resources, this is a very controversial one because of the dynamics surrounding this guy, but I think he makes really good medical resources, and it's a really good resource. So maybe don't look into the guy, but use his resources. This is the Mehlman High Yield Arrows deck from MehlmanMedical. He is a physician who posts basically prep questions, and he has a lot of resources. His website is MehlmanMedical.com, and he has a tons of PDFs and everything like that. They're basically what is high yield for your boards, and he uses the same approach of how do you get the most amount of questions right. For his Mehlman High Yield Arrows deck, it is a physiology arrows deck, and I put one of the cards right here just so we can look at it, but basically it just gives you the most bare bones skeletal presentation, and you have to know how it affects certain things, like does glucose transporter 4 expression increase or decrease whenever they have, you guys haven't taken endocrinology, but in this case, he has diabetes insipidus. So all these arrows will change. It'll say with this pathophysiology, or if he's in DKA or something like that, how does it affect the expression of this channel? How does it express, how does the biochemistry change in the rest of it? And I think learning the arrows for physiology, like same way you learned in MSK, like what happens if vitamin D is activated? What happens to parathyroid hormone? What happens to calcium? What happens to phosphate? And then what happens to like osteoblast activity, osteoclast activity? Like those are things that are connected together that will change together based off of the pathophysiology or the presentation that the patient has. I definitely use these in the last couple of weeks just for extra Anki cards. It's 130 cards. They all look just like this. You can click the one by ones and see exactly what shows up on them. And for the most part, I flew through this deck in like 3 hours because I'd already reviewed all my physiology, and it comes with explanations and everything like that on what shows up the most. So this is a very high yield topic, especially if you're taking STEP. 100% recommend doing this because a lot of your STEP questions will look just like this. It'll have a big paragraph, and all the answer choices will either be up arrows, down arrows, or sideways arrows. I probably came across like 30 questions on my STEP exam that were just arrows, up, down, no change, up, down, no change. And it's like A through F of just what do the arrows look like. And if you also want another board resource, he has a YouTube channel that he puts up a practice question every day, and he just goes over it. He talks about it. He talks about how you should be thinking and approaching your practice questions, and I personally use this every single day. It was one practice question, and by the time I got close to my boards, I was getting all of them right. But hearing his explanation, hearing him tell me not to overthink on these questions, and what information I should be extracting from questions helped a lot in terms of my board prep and how to approach the practice question or questions in general in the exams. Going on to question banks, one of the big things you need to drill into your head is that question banks are a learning resource. I did not bold the CE, but it is a resource. It is a learning resource. You should not be testing yourself using practice questions. You will get them wrong. You will hate yourself. It is okay. Learn from the opportunity and get better. This is not something that you should be scoring 100% on. This is not something that you should be embarrassed to have a low score on. This is a learning resource. Everyone will move at a different pace. Everyone will have different strengths. Everyone will have different weaknesses. Don't beat yourself over a low percentage. Let's say you did 40 questions and you got 8 of them right. Doesn't matter. Let's say you did 40 questions, you got 32 of them right. Still does not matter, right? You need to be approaching all the questions you got right on, did I get it right because I knew it, or did I guess on it? And the questions you get wrong, you're 100% reading the explanation, thinking about how you approach the question. Did you get it wrong because you underthought it? Did you get it wrong because you just didn't know the question material? Was it a content error? Or did you just get it wrong because everyone else got it wrong? Well, those 3 of the main points that I've seen a lot of my fellow classmates beat themselves up over is having a low percentage of uWorld. uWorld is a hard resource. I don't think I broke 50% correct on uWorld until like 2 months out of my board exams. Don't beat yourself up over missing an easy question. If you got it wrong because you got super confident over it, think about it. Why did you get overconfident? What did you miss? And why did you jump the gun, right? So if you're missing easy questions, think about why you did it. And the next time you see an easy question where you want to jump the gun, you'll think about it. You'll be a little more cognizant. You'll be a little more conscious about why you're picking the question. It'll make you think a little bit more, and you'll get more questions right. And then the last one is don't beat yourself up over a low percent correct question. You will come across questions where only 12% of the people got it right. And you'll see that the majority answer that you chose, 72% of the people picked it and got it wrong. Don't just throw that question away. That is a huge learning question. And I think I learned the most from the questions that had the minimal, low percent correct questions. So look at them. They're scattered throughout uWorld. They're scattered throughout TrueLearn. Just to trip you up, the biggest thing is just don't get emotional over it. This is a very hard process, and you will find these questions. You'll think they're bullshit. But you sit down and you treat it just like every other question that you reviewed. Because 100%, I see people in my class get completely worked up over this question, call it a stupid question, and then move on and never review it, which is a loss of an opportunity right there. This is what I want to say for question banks during you guys' second year before dedicated. I want you to use the question banks for systems that you're currently learning. So you guys will go into GI for the next, I think, 5 or 6 weeks. If you're using TrueLearn, you'll get access to the second year TrueLearn, which is the full TrueLearn question bank. I think within the first week, or you might already have access to it. But you should be doing all those questions as well. I know people like to use the peer review questions and stuff like that come from our peers in terms of topics and stuff like that. But I think that the question bank questions are a lot better, and they're going over high yield. They give explanations. If you have time to do the peer review questions, you can do those. If you want to choose a peer review questions, you can do that as well. But you should be exhausting your entire resource of questions for that block before you leave that block. In terms of GI, let's say there's 362 questions for GI. You should find a way to organize, find a way to do those questions based off those topics, and by the time you finish GI block, that last pharmacology exam for GI, you should have done all your questions for it. You should have 0 questions in the bank for GI. And that's what you're doing for renal, that's what you're doing for hematology oncology, that's what you're doing for repro, that's what you're doing for endocrine. And that will help you understand the most amount of content, and that will help you board prep on top of studying for your in-house exams. Because remember, we're doubling up on this, and the questions are good. I don't know about you guys as peer review mentors and stuff like that, but for the most part, they just copy questions or find the most high yield topics and just copy and paste them. And I think that most of them are very first order. So going through question bank questions on TrueLearn or uWorld really helps you test your knowledge and kind of go through questions and find what content gaps you have. At the end of the day, you want to fill all your content gaps. There is a way to stratify your content. So on questions on TrueLearn, you can click GI and then you can click like embryology or anatomy or physiology. You can do it that way. It does not have to be random. You can really stratify and find specific questions that you want while you're in that block, and it doesn't matter. As long as you're doing questions and you're exhausting your resources and learning from your questions, you're doing board prep on top of studying for your in-house exams. Continued, this is what I was talking about earlier. Things to look out for is get used to patterns of how certain questions are asked. There is only a finite number of ways a question can be asked. In this case, I put a micro question. This, for the most part, is comprehensive for micro questions. Any micro question you see in TrueLearn or uWorld will have the same question. It'll ask either what is the bug, what is a risk factor associated with this bug, what is the first line treatment for the bug, and what is the mechanism of action of the first line treatment. I know you guys learn all these like crazy things where like the patient has like a sulfa allergy, so you can't give penicillins or cephalosporins if they have like a penicillin allergy and stuff like that. That's not how it is on the COMLEX. That's not how it is on STEP. They're not trying to test your doctoring ability of treating patients. They're trying to find, do you know how the medication works? Do you know when the medication is used? Do you know how to diagnose a bug? Because on step 2, it gets a lot easier. You get a culture and it tells you what bug it is. You don't have to know if it's gram positive, coagulase positive. You don't have to know, I don't know, whatever the little factors are of each bug for step 2. But in step 1, you need to be able to identify the bug. You need to be able to do it backward and forward. Sometimes they'll give you the bug and ask you to identify topics or like identifying factors of the bug, or they'll give you all the identifying factors and ask you what is the bug. Risk factors are basically, like diabetes for Pseudomonas, diabetes for mucormycosis, diabetes for Candida infections, prosthetic heart valves for epidermidis, prosthetic heart valves for Staph aureus, sickle cell for osteomyelitis and salmonella, like stuff like that. So knowing those high yield risk factors, all shown on SketchyMedical, which I think is still a really good resource. I think about the sketchies every time I do these questions, and it really helps a lot. And then first line treatments for the bugs, you watch your pharmacology, you watch your Sketchy Micro. The micro has the pharm in it as well, so it's kind of nice because they'll integrate it all in there. And then MOAs and everything, you'll learn that from Sketchy Micro or Sketchy Pharmacology videos. And then for completion goals, I think that you should generally try to finish every QBank that you have prior to resetting your deck. In TrueLearn, there's about 2,900 or 2,800 questions, and you should be getting 100% completion before you reset the deck. Resetting a QBank basically keeps all the questions that you have, but turns them back into new questions. So it still keeps your count of how many questions you've done, but it puts them all back into your new pool. And doing that, I think, helps because it'll re-randomize all your questions. So let's say you already did all the GI questions for block 5, right? And so when you're studying everything else, you'll never get a GI question. But once you reset your thing and get all your stuff back at the midpoint of your dedicated, you'll start getting GI questions back. You'll start getting renal and repro questions back and stuff like that. And then you'll be learning like, hey, did I actually understand this or did I memorize it and forget it? Because at the end of the day, same thing, you're trying to get the most amount of questions right, and there's a lot of information. So you just keep going, and one of the things that we all noticed for us is that TrueLearn is not a true random. And the questions at the end of the bank are just as useful as questions at the beginning of the bank. What I mean by not a true random is that whenever you queue up for 40 random timed questions, or 44 in this case, you will get the same, if not half the same, 40 random questions as someone else. Like, depending on what day or what time you do it, you will get like basically the same questions as someone else. So there's a linear order of randomness in TrueLearn as you go. So the weird low yield random topics I found were at the end of my question bank. All the micro, all the high yield and everything was like randomly at the beginning of my question bank. So as you go through it, it will get a little weird, but you need to be chasing every question and you need to be giving every question the same amount of respect for the most part. I don't know if that's a weird way to put it, but That's how you have to do it. And then uWorld is hard. I don't think I scored, like, you know how they give you the average of every question you've made? I don't think I got above 51% until like 5 months of doing uWorld. So it takes a lot of time, but once you crack how uWorld asks their questions, everything gets so much easier. Like, it's just a different way they ask questions. And I personally went through all of TrueLearn. I probably did like 800 more after resetting it on TrueLearn, and then I just did uWorld once and then never looked at it ever again. Yeah, it wasn't like a resource that I felt like I needed to go through more than once. But TrueLearn, once you reset it, you'll see that all your scores go straight back up. You'll start scoring in like the 80s and 90s because you'll get like all the random microbiology questions back. You'll get all the GI questions that you've already studied, and you'll get all this stuff. For the most part, I wasn't somebody that remembered questions. There's a lot of people in our class that can just be like, oh, I remember seeing this question, so this is the answer. But even if you get that, I want you to like approach the question like you've never seen it before. Even in a pool of like 2,900 questions, you'll find questions that you've seen before. So give them the same respect, give them the same amount of time, treat it like you would any other question, and then just go on with it. If you got it right, you got it right. If you got it wrong, why'd you get it wrong? Going into specific QBanks, uWorld is the gold standard for step 1. This is what you guys were asking, or how are the questions on uWorld compared to STEP? I want to say that questions are generally on par with the board exam difficulty. uWorld is slightly harder, but most questions on step 1 were on par. One thing I noticed about step 1 is that the questions are like 17 lines long. Every single question on step 1 is like super long. I was really fatigued at the end of step 1 because I'd read so much. My eyes were hurting and I was just completely tired of it. And remember that question banks are a learning resource, so it's best for question practice and learning through doing questions. I personally like the way that uWorld has their explanations. The people who write the explanations for that uWorld questions are like pretty good compared to TrueLearn. TrueLearn isn't bad, but I will say that for the most part, their explanations can be hit or miss based off of how you missed the question, and I didn't find it super useful. I still use them. I still use the charts and everything. They give really good charts. I think I ripped like half the charts from uWorld and TrueLearn when I was doing my dedicated studying. Like, I screenshot entire charts and stuff like that and save it for reference later. So make sure you're going through your explanations and kind of grabbing what you need. These are my tips. The tip is to start early. In this case, board prep as you go through your systems, and then use tutor mode while you're in your blocks. You will get the eventual, you should be doing 5 practice problems a day from your school, and I think you're fine. Just keep doing the tutor mode on everything. If you really want to do a true random of 5 or 10 questions every day, that's up to you. It doesn't really matter. Just make sure you don't bias yourself of, oh, I haven't studied this yet. This question was not useful to me. If you're getting a question wrong, it's in repro and you're still 6 months from repro, sit down and look at it. Try to figure out why you missed it. If it's just a content error, just say it's a content error. Write something down or go into your first aid and highlight it. So when you finally come into repro, you're like, oh, I definitely didn't understand this, or I definitely didn't know this at the time. So I didn't use random questions until probably end of endo, which is like the first half of block 6. Y'all are going to block 5, right? Yeah, so block 6. It's like the first half of block 6. Endo's a huge topic, and once I finished that, I started doing like random questions and stuff like that because I'd already board prepped like neuro and MSK and stuff like that beforehand. But getting GI under my belt, getting renal under my belt, that was like a huge content. Like, GI and renal are huge in practice questions, but they really don't show up as much in the actual boards themselves. For reviewing your explanations, this is what I did, and I really found it helpful. I didn't start it off this way. This is like kind of what I gathered from other people in my class and like looking at other resources on Reddit and YouTube and stuff like that on how people were reviewing their questions. And this is kind of what I found to be the best way to review a wrong question. For notebook, I had these 3 things. So I kept a notebook with me. I don't have it because I moved it into the city that I'm doing my clinicals, but I wrote out the topic that I missed and all the information that might be relevant to the correct answer to get me to the correct answer next time. So I would have to reflect on why I got this question wrong. If it was a content gap, I would look at the question and I look at the explanation and I'm like, all right, what did I miss here? Like, what was a vital part in the question that I did not think was important? Or what was a vital part in the information in the question that I just didn't know what it meant? And then you approach that and you look at it and you're like, okay, so this was a content gap in my part. I'm going to do better I'm going to write down the chart that's in the explanation, or I'm going to review the chart that's in the explanation, or I'm going to write out 2 or 3 sentences of what this question was asking and where I need to get to. And first aid, I already told you guys, just highlighting the topic that I missed. I would go into the first aid. I missed a lot of like nephrology questions. So going into neph and looking at like different types of casts or different types of like infections and stuff like that. I would go over there, I'd highlight it, I'd look at it, I'd be like, all right, this is the medication I missed, this is the diagnosis I got wrong. How can I get it right the next time? And then Anki, same thing. I was doing my Anki cards every day, but I would reset or unsuspend the card in my AnKing deck. Just like I said, if you think you'll get a question right on it, you don't need to do the card. But if you get the question wrong, throw it into your AnKing deck. Start doing it that way, and that way you're only learning topics that you got wrong and not memorizing things that you already know. Because there's a lot of information, there's not enough time. The next QBank is TrueLearn. This is the gold standard for COMLEX Level 1. I will say that this one is actually on par with the board exam difficulty. TrueLearn has a weird way of asking questions, and I think the COMLEX also has a weird way of asking questions. But TrueLearn gives you a lot more context than the board exam actually does. So sometimes TrueLearn will give you 3 or 4 identifiers or 3 or 4 buzzwords, whereas the COMLEX only gives you like 1 or 2. Or you need to be able to identify what it is based off of the one symptom that the patient has. And I think that the hard questions on TrueLearn are just absurdly hard. And the most consistent TrueLearn questions are basically consistent with your COMLEX. And this is same thing as well, learning through while you're doing your questions. Don't feel bad if you get low percentage on your questions. Don't feel bad if you missed a question that you thought you already knew, right? So this is a learning resource. Don't get caught up on the question numbers. Don't get caught up on your percent correct. Don't get caught up on your like national percentile. Those are all BS numbers. Don't look at them. I hide them. I have them all hidden. The only thing I have on my TrueLearn is on my visible dashboard is the number of questions that I've done, and that's it. Going on to AMBOSS. I personally didn't use this one, but a lot of people in my study group recommended it. They used AMBOSS as their secondary resource. They actually bought AMBOSS and uWorld. I don't know if I recommend that. That's a lot of money. But AMBOSS is really good because they have like the Anki add-on, and they have articles and stuff that will supplement why questions are the way that they are. But I found the questions that I did on AMBOSS through other people to be way harder than step questions or COMLEX questions. And again, it's like a learning resource, but this one really like hits your ego. They ask the weirdest questions in the weirdest ways, and I think they're out there. But the way that they use their difficulty rating is the hammer. So they use 1 to 3 hammers, and it goes all the way up to 5 hammers. 5 hammers is the hardest question. 1 hammer is like the easiest question. So I think sticking to 1 to 3 hammer questions, like your high yield topics, your easier things, the way they ask is a little generally better for board prep. And if you're getting all those correct, move on to the 4 and 5 hammer questions. Really test yourself, find the ways that you can do it. On AMBOSS, there's a way to stratify the difficulty of questions that you want in your question set, and just stick to 1 to 3. And if you're getting all those correct, like I think like 80 plus or something like that, move on to 4s and 5s. This is like mastery content level questions, and you shouldn't be getting these right. If you do, pat on the back. And then I have the same thing, learning resource. Question banks are learning resources. Do not test yourself with these. You will get a lot of questions and you will get really humbled, and it will like induce so much anxiety. Don't even try it. So going on to your testing resources, there is a lot of testing resources, and you will likely be doing every single one of them, as scary as it sounds. But this one I'll kind of glaze over. The NBME, which is the same thing as the CBSE. These are practice exams for step 1. These have the best for predictive score and assessment of readiness, and it helps to get comfortable with formatting and timing. This is the biggest thing of why to take practice exams. the way it appears on the TV or on your monitor and stuff like that looks different. It'll kind of simulating the testing environment gives you the anxiety. Seeing how it's in like type font. It's not even in like Arial or like Times New Roman. It's in like a weird type font, and you need to get used to seeing that. You need to be able to read it. You need to be able to highlight and go back and forth. So taking these practice exams really help you get comfortable with the formatting. And you don't want to show up on test day, never have seen the formatting, and get thrown off by the formatting, right? So when I took my first COMSAE exam, I did significantly lower because I wasn't used to the formatting. I wasn't used to the like manual highlighting or the manual striking out. When you take your STEP exam, it has auto highlight and auto strikeout. When you take your COMLEX exam, you have to use a shortcut or the little highlight button at the top to highlight or strike out your questions. That takes a lot of time, and it takes a lot of brain power. You might not think it does, but it will throw off a question if you really need to focus on it. So I recommend learning the keyboard shortcuts for those things. And then NBMEs, take at regular intervals during dedicated. These are not things that you'll be taking like throughout your blocks and stuff like that, and then review them thoroughly. I think that reviewing practice tests is the best resource for reviewing questions, because these are questions that are written by writers of the examination, and they have an explanation that goes over the thought process of what those writers were thinking when they were writing the question, and what information they wanted you to pull from the question, what information was a red herring, and what information was just useless. I put a little bit of goals. This is basically what you'll find on Reddit. This is basically what every student who has passed these exams recommends. And this is, each NBME comes with an EPC, an estimated pass chance, and try to get that as close to 99% as possible. This means if you took the STEP exam within 7 days of this score, you have a 99% chance to pass the STEP. You'll never get 100% because so many things can happen, and putting a 100% guarantee on something will, it's liability. So they'll never do that. You'll never find something that tells you have a 100% chance to pass. If you find those weird clickbait videos are like, this is how you should be studying, don't watch them. They're a waste of time. You should just stick to what your schedule is that you made at the beginning and just work through it. And then at the least, just make sure you're consistently scoring above 65%. This is 65% correct questions, not 65% EPC. I think I fixed it on the next one, but above 65% raw question grade. And if you're doing these, this is what everyone recommends. If you're doing step 1, take NBME 26 through 31. And then if you're taking level 1 and you really want to take NBMEs, take 29 through 31. And I have a little breakdown of what I took at the end of this PowerPoint of what I did, what helped me, how I was scoring, and stuff like that. NBOME, which is the same thing as a COMSAE. You'll see these terms used interchangeably. They mean the same thing. These are practice exams for level 1, so for your COMLEX, and these are the best predictive score for assessment of readiness. They help you get comfortable with the formatting. The one thing I will add is that the COMSAEs have auto highlight and the COMLEX does not. They will have auto highlight on the COMSAE, but the COMLEX will not have auto highlight. So don't get confused and think that you'll have auto highlight. It may not seem like a lot. You'll be really like, why is he harping on this the most? But it is really, really important because it can make or break a question, and it can make or break your focus on a question. If you have to think about how to highlight, how to unhighlight, how to strike out an answer choice. And same idea, you take these at regular intervals during your dedicated. And one of the weird things about COMSAE is that it comes with a Likert graph of performance. Basically, it shows every single system or every single subject. It shows both, and it shows you how well you performed. And it gives you error bars and everything, like if you're performing under expectation, average performance, or above expectation of your performance. So you use that of like, for me personally, reproductive was my worst topic. Reproductive, I never got into like an average because I didn't understand it. I put a lot of time into it and I just never could figure it out. And my Likert graph for reproductive was always in the red, while everything else was either average or above average, right? So it tells me that, I am doing fine in everything. Repro is just what I need to focus on, and I ended up spending a lot of time in repro. And I think like 4 or 5 days before my step, it finally clicked, and I don't think I missed a single question after that. In terms of goals, each COMSAE comes with a 3-digit score. It ranges from, I think, 200 to 800. And at our school, a 460 is what you need to pass a COMSAE. So they have practice COMSAEs on the NBOME website that you can buy. I think they're $60 or $75 each. I can't remember how much they are. But you buy those, you take it, it gives you a score, and if you're scoring above a certain threshold on those, you can feel confident going into your COMSAE, the in-house exam that you have to pass to sit for the COMLEX. What's up, man?
So when we are in Block 8, we take multiple shortened COMSAEs, or if you take the first one and you get a 460, you're not obligated to take any more.
Through the in-house stuff,
Yeah.
through VCOM. Yeah, so once you pass one, you are eligible to sit for the boards. The only thing you need, the school sanctioned one, is you need like a 460 to get you eligible to sit for boards. There are two types of COMSAEs. They have the released COMSAEs, which students can purchase, and then they have institutional COMSAEs, which no one has access to except for schools. And
Okay.
you'll be tested on institutional COMSAEs, which are basically the same as COMSAEs, right? They're just, you can't access the questions. No one has access to what the content is on those. And there's 3 attempts that you have to pass an institutional COMSAE. If you pass on the first one, you don't have to take the rest of them. And
Okay.
there's not a single person who passes the first one who sits for the second one, like voluntarily. You know what I mean?
Yeah.
So
Okay.
once you pass a 460, I want to say it's like an 85% EPC. That's what I found on Reddit and all these threads, but no one actually knows. No one actually knows anything. The COMSAE, the NBOME don't release this information. No idea why. The USMLE, the NBME, they release all the information. They're like, here, just have it. We want you to be the best student possible. But the COMSAE, the NBOME, they keep all this information hidden, and who knows why. So there's some digging, but no one actually knows. And I've asked Dr. Carlson at our school, and she's also just like, I have no idea. And no one knows these things. Even the institution doesn't get information on this. It's just very secretly kept by the NBOME. In this case, for each COMSAE, you'll be able to review all your questions, and you'll have to manually find your percentage because it'll only spit out a 3-digit score. So you go through the whole COMSAE again, you find how many questions you missed, and you get a percent correct, and you should just be scoring above, or aiming to score above a 65% correct. Like 65 is the magic number here. 65 might feel bad, like 65% on an exam is failing, right? But 65% on a board set or board test or practice test and stuff like that, it's good, right? One other resource by the NBOME is the WelCOM exams. There are 4 exams provided by the NBOME that are written by the COMLEX exam writers that mimic level 1 questions. Please do all of these. I had questions that were verbatim show up on my COMLEX. I did all 4 of these. There's 75 questions each, totaling 300 questions, and I probably had like 6 or 7 show up on my exam like verbatim. And I know it doesn't sound like a lot, but those were 6 or 7 questions that I probably would have gotten wrong. Like they were just so niche and weird that I spent a little bit extra time reviewing it, and I was like, why is this a question? And then it showed up on my COMLEX, and I didn't even think about it. And I was like, oh, I've already seen this question. Click, move on. So, like verbatim, like the exact same wording and everything. And when to do these, this is the week leading up to your examination. I have my board schedule and practice test schedule at the end of this PowerPoint, and I'll kind of show you where my exams fell in. If you're taking the USMLE Step 1, the free 120 is basically the same thing as the WelCOM exams. This is 120 questions provided by the NBME that are written by STEP exam writers that mimic Step 1 questions. This one is free because they love giving free resources. The NBOME doesn't. You have to pay $75 for each of these, or you can email me and I'll send them all to you. Anyways, this is when to do this. It's actually in our Google Drive if you haven't looked at it yet. But when to do this, the free 120, you want to do it exactly 7 days prior to your Step 1. Exactly 1 week. You want to sit down at 8 a.m., take this exam. It's 120 questions, and you want to review this thoroughly. This is the most predictive exam for STEP. So if you score like a 78 on this, you're good. If you're not scoring above 65, you need to move your exam. If you don't make a 65% plus on your free 120, move that exam, because there's no way you're passing your STEP. By God's grace, you could pass the exam, but why would you do that to yourself? Last thing for practice tests are the uWorld self-assessments and the TrueLearn assessments. These are things that come with your purchase of a question bank, and TrueLearn assessments come with TrueLearn. For our school, the TrueLearn assessments are used as the testing resources. Like you'll get a schedule later, and you're taking like a practice exam every Friday or Thursday during dedicated for like a month, and these are like sprinkled in there. And the uWorld self-assessments are, if you buy uWorld, you get access to these 3 self-assessments, and you take them whenever you want. Remember that these are learning resources. Don't beat yourself up over the grade, and review these thoroughly. You should just be doing all of them. There's 3 uWorld assessments, and there's 2 TrueLearn assessments. Don't ask me why we don't have TrueLearn assessment 1. I have no idea. I literally have no idea. But we have 2 and 3. You do them both. And our school will make you do them both. So there's no like if in our case. Okay, so those were all the resources. I went through textbooks, I went through third-party resources, I went through question banks, and I went through practice tests. That is basically all you need for your board prep, and you should be finding ways that you learn the best, retain the most information using any of those resources. You shouldn't overload yourself on resources. For me, Boards and Beyond for physiology, Pathoma for pathology, SketchyMicro for microbiology, SketchyPharm for pharmacology. And that's all I needed. That's all you need. And that's what worked for me. If you find some other resource, let's say you like the Goljan Patho textbook instead of the Pathoma book. You read that book, it's still a comprehensive review source of pathology, and you're fine. You don't need to be using 2 resources. You don't need to read the Goljan pathology textbook and the Dr. Sitar videos and the textbook. Like there's no need to double dip. You will learn the most amount of information doing your practice questions. You'll find what information is really high yield based off of practice questions. Like if you see like 10 or 12 questions on the same topic, it's probably really important. If you see one question out of an entire question bank on it, it's probably not that important to learn the topic, right? So you're trying to be efficient with your time. There's no need to double dip on any of your resources. You don't need to read the first aid pathology all the way through and then the Pathoma all the way through. You're just double dipping. You're wasting a lot of your time. If you start a resource and find that it's not helpful, it's okay to switch. Just make sure you just keep reflecting over and over again on, am I retaining the information? Is this helpful for me? And am I getting these questions right based off of information that I've already learned? And if you can say yes to that, the resource is helping you. If it's not, find another resource. This is for everything except microbiology and pharmacology. You need to watch those videos. I don't care how much you hate it. I don't care how ADHD you are. You sit down and you watch those videos because there is no other resource that's as good for pharmacology or microbiology that is comprehensive. Going on to this is our general board prep timeline. So starting from OMS 2, I've already talked about this just a little bit, but this is the PowerPoint slide that you'll be referring to. Starting from OMS 2, you'll board prep the system that you're in and catch up with micro and farm from OMS 1. The general thing is to be done with SketchyMicro and SketchyPharm by the end of block 7. So that means watching all the videos. If you're using Anki, doing all the cards. If you're keeping up with board prep, that means doing all the questions as well. You will have done all the SketchyMicro and SketchyPharm questions, or just microbiology and farm questions. If you're doing your systems-based stuff, it'll all be sprinkled in there, right? Like you're about to start GI. When you do GI Farm, do all the GI Farm questions along with it. When you do GI Micro, watch the sketchies and do all the questions with it. There's not that many, and micro and farm questions go by super fast. You probably get like 80 of them, and you'll probably finish it in like 35 minutes. Because remember how we talked about the patterns of how questions present? As you do those questions, you'll be like, oh, this is what the question's asking. I already got my bug. I don't need to read the rest of the question. Or this is the medication they're asking for. Let me find out what bug they're asking, and you just move on. Like at the end of my board prep, I was probably 95% on all my micro and farm correct. And it was like a kind of a break when a question like this popped up because I knew I was going to get it right. There were some on my actual COMLEX and Step that were a little hard and weird ways, and that I had never seen it before. But I used like process of elimination. I looked at the patient, what they were presenting with, and it kind of pointed me towards the right direction. At the end of the day, the answer is in the question, right? You should be able to extract the right amount of information and make the right diagnosis or answer the question correctly based off of the information that's given to you. So that's for your second year. For OMS 1 systems and biochem genetics, immunoepi ethics, you can easily board prep these in about a month to a month and a half during dedicated. These are topics like MSK. MSK is a huge one. MSK is going to include OMM as well. And the first 3 weeks of dedicated is literally like ACLS and OMM. So if you're doing MSK board prep with OMM, if you double dip those two things, you'll be so far ahead. Because then you learn like radial head somatic dysfunctions and all the nerves and arteries and stuff in the brachial plexus. You'll get that review again, right? So as you're learning those things, do like your MSK board prep. And then once you finish and go into real board prep dedicated, which is like I think 3 weeks into block 8 for us, all you'll have left is neuro, cardio, opto, oto, and respiratory. And you can easily do those 4 to 6 weeks. You give a week for each one, and you'll be golden. And then by the end of that, you should have like just biochem, genetics, immunoepi, and ethics left, and you'll learn those mostly through the cards, or not through the cards, through the practice questions that you're doing. You'll find what information is super valuable. You'll find what information is not valuable at all. Like vitamins, I said, are really high yield biochemistry topics. I can't even name, like maybe like 25% of what you learned in block 1 biochem is actually board relevant, right? So finding out what is board relevant, what isn't board relevant will save you a lot of time. I know a lot of people struggle with these like undergrad topics, like biochem, like the more sciencey topics and not the medical topics. But we have really good professors, and talking to them, using them as a resource to understand, like I don't know if you guys know, but the Morrows that we have at our school, he and she Morrow, they both write for the COMLEX. He Morrow writes genetics and biochem for the COMLEX, and she Morrow writes immunology for the COMLEX. So using them as resources, talking to them and asking them, hey, what kind of stuff have you seen show up on the exams? Or what are some topics that you think are really important? I sat down with Shi Morrow for probably 3 hours on one day, and we talked about all of immunology. I did the same thing with Himaro, and I sat down, we talked all of biochem, and we talked all of genetics and stuff like that, and it helped a lot. It helped me understand what was important and how I should be approaching the questions. Because at the end of the day, it's not a sciencey topic, it's a medical topic, right? Your patient's going to present with something, and you have to connect it to biochem. So if you can connect the medicine to the science, you'll feel a lot better answering those questions. I know it doesn't make a lot of sense yet, but once you start doing more biochem questions and practice questions and stuff like that, you'll notice that there's a very obvious medicine component and a very obvious science component to it. Like MCAT stuff, you know what I mean? Like gluconeogenesis pathways, or like amino acid breakdown pathways. Like that's all the sciencey stuff. And the medicine is like, patient presents with like organomegaly. Their spleen is gigantic. They're jaundiced AF. Like why? And then you connect it to the science, and being able to make that diagnosis here really just turns into a first order question. So these topics that are like biochem, genetics, immuno, which are really like sciencey heavy, require the most amount of time in terms of like understanding how to approach those questions, right? Because you're trying to get them all right at the end of the day. And then one big tip that is like a rip the band-aid off kind of idea is don't hide behind content review. You should be actively testing yourself at all stages and treating missed questions of an unreviewed system the same as a reviewed system. So if you're doing random questions, and let's say you're in dedicated already and you haven't seen any neuro, you haven't studied neuro, you haven't done anything with neuro, and you get a neuro question, if you get it wrong, you need to be understanding why you got it wrong. There's not a single time that you should guess a practice question. You should sit down and approach every single practice question the exact same way. And if you get it wrong, you have to go through that checklist again. You have to go through, why did I miss it? Was it a content error? Was it something I just didn't know? Or did I see two like pathology descriptions and I confused two things together, right? Like at the end of the day, you're getting the most questions right. And if neuro is like a weird point for you where you understand, let's say neurophysiology, but not neuropathology, you're going to waste a lot of your time studying neurophysiology when you don't need to, right? So at the end of the day, when you're going through your board prep and you're dedicated and stuff like that, you want to be studying things that you don't know or that you keep getting wrong. And I know a lot of people that are just like, I'm not going to take practice exams. I'm not going to do anything until I cover all the systems. And it's a trap. You're going to lose a lot of time. You're going to miss a lot of review for systems that you've already covered and weak topics inside of those. So if you're actively reviewing things, even if you miss the question because you've never seen it before, like let's say a stroke, right? Let's say you haven't reviewed any of the strokes yet and you got a stroke question wrong. You can easily say like, hey, I missed this because I didn't know neuro content, and review your strokes or something super quickly, because you'll go over it again when you're doing your neuro dedicated. And then let's say you also missed a GI question in the same practice test and you're like, oh, I thought I knew this, but I didn't know this. So you found the opportunity to go over missed topics of systems you've already reviewed and learn a little bit about content that you haven't reviewed yet. So when you actually go and learn about strokes, you'll get that repetition of like, hey, I know what a MCA stroke looks like compared to a ACA stroke. I know what left looks like versus right. I know which way the uvula deviates, right? And stuff like that. So then you get a little bit of that peppered content. And then when you actually go and learn it, it'll be a little easier to recall that information. Is that it on this? Yeah. So one of the frequently asked questions. So this was something that popped up for us whenever they gave us our board prep like class-wide meeting thing from the school. They just told us to be boards ready for the system by this period, by this period, by this period. And no one really knew what that meant. And so a lot of people just kind of brushed it off and didn't really like fully comprehend what it meant to be boards ready for something. So I kind of did a little bit of research. I asked Dr. Carlson and got this basic guide of like what it means to be board ready for a system. So board ready is a term used to describe a person who has reviewed and completed all applicable material for a certain system. This includes embryo, anatomy, physiology, path, micro, pharm, and all the practice questions. If you look over to the side, there's a lot of systems. And each one requires going through, let's say, MSK. You need to know MSK, embryo, anatomy, physiology. Each one of these systems has a section or a subsection of every single one of these. So as you're going through GI, as you're learning the embryo for GI, go watch the Boards and Beyond video. Go watch the Pathoma video on it, so you're not having to do twice the amount of work. One good thing about our school's second year is that it becomes really board focused, where the information they ask is usually only board relevant topics. They won't ask you things that are like, PhD questions and things that aren't on boards, but people find important for medical knowledge. You won't find a lot of those. There's one specific exception of reproductive, but you guys can handle that when you get there. So going through all these things for, let's say you start with right here, right? So GI, renal, endocrine, repro, hemonc, psych. This is what your second year is going to look like. And going through all of these in real time, it may seem like a lot. It looks really daunting right now, but the embryology GI chapter is probably like 1.5 pages on first aid. The anatomy of GI is something that you'll be learning through all the PowerPoints and your cadaver lab. Physiology is your cell bio classes, right? It's your clin med. It's pathology is your path class, right? All those SDLs and everything. Micro, pharm, they're all in your clin med classes, right? So you're already learning the information, and supplementing board material on top of it honestly helps you streamline what you should be learning better. I don't find the in-house PowerPoints very helpful. I don't find like the SDLs helpful at all. And I think that using other third-party resources like other students at other medical schools do is more available during the second year. Like you can actually do it and get away with it and still pass your exams, do well on your exams without missing a lot of questions and also without memorizing things. You know what I mean? Like we cram so much for our exams and we feels like we don't have a lot of time for them, but using resources that have streamlined all the content makes it so much easier. It makes it tons easier. Like your entire pathology SDLs, there might be 11 of them, but it's an hour of Pathoma videos. It's the same content, same everything, right? And when you get to your examinations and stuff like that, like this is what's going to show up on your exams, barring a few like weird low yield topics that only appear on the SDLs that are not on boards. one thing you'll notice if you're going through SDLs is that there's a lot of information on those SDLs that are not on boards, like tons of information. Like if you streamline those SDLs to boards only, it'd be like 3.5 pages max each one. And then doing all the practice questions, just like we talked about, do the practice questions. 300 practice questions may seem like a lot, but spreading them over 5 weeks of GI is like 7 questions a day, which is like nothing, right? Or if you're studying for, let's say, your GI anatomy exam, there's like 64 questions, let's say. You can knock out 64 questions in 2 hours, right? So doing that, you get a good idea of what's high yield, how things are asked, and if you're missing stuff, like why you're missing it. Or if you're getting stuff right, you don't have to spend a lot of time studying that stuff. One exception that we'll make is ClinMed. ClinMed is very like step 2 focus kind of things. So you won't find it on a lot of your step 1 board prep stuff. So going through and looking at the PDFs and stuff for ClinMed is something you have to do. Like you treat it like the same way you would an OMS 1 class. So that's how you go about it for being boards ready for a system. You'll hear everyone at our school say this, like as you approach second year, you'll start hearing the term boards ready a lot, and this is what it means. And then you can also keep like checklists and stuff like that. I have a link to a bunch of checklists and stuff that we used, and kind of making sure that you're hitting every topic, because it's kind of hard to be like, hey, there's 116 SketchyMedical videos. How do I keep track of which ones I've watched and which ones I haven't? And you can do it manually, like keep an Excel spreadsheet, but there's already things that exist. So utilizing your resources to maximize your time is going to be the best way to approach this. Some of the mindset tips that I learned either from friends, mentors, teachers, or I learned the hard way, that I think that a lot of people should hear and kind of hear going into their board prep. First one is that this exam not only tests your ability to retain and understand the entire depth of medical knowledge, but also tests your ability to perform under pressure. This is a really big one, because you will show up to your board exam and you will see a question that you have no idea. You will show up, no matter how much you study, no matter how many questions you've done, you will show up to your board exam and you'll be like, what the hell is this question? I've never seen this topic. I've never seen how this question is asked. And you will have to answer it just like you would every other question, right? So when you're under pressure, you kind of spend more time on those questions, right? And then you look up in the corner and your time's running out and you're like, what the hell is going on? I felt prepared. I did all these questions and everything. Why am I not feeling confident about it? And it's because these exams have it in their blueprint that they will ask hard questions to try to throw you off, to make you perform under pressure. I will say that, like, I've been telling everyone on mine that, like, on my COMLEX, I probably got a super difficult question, 1 of every 4 questions on that COMLEX. So I got like 3 questions super easy, and then I get to 1 and I'm just like, dude, what is this content? So it's really hard to walk out of these exams feeling good. I don't think I walked out of any of my exams feeling confident that I passed. And I don't think I walked into any of my exams feeling confident that I was prepared. No matter how much you do, no matter how much or how long you've done it. Like I probably board prepped actively for 9-10 months. I didn't go home. I literally just board prepped and stayed here, and block breaks I was here whenever other people were out and stuff like that. Like all my Fridays, I literally sat there. I took practice exams on the weekends, and I still didn't feel prepared for all my stuff. But you need to be able to have the confidence in your preparation and stick to your plan. And at the end of the day, you'll walk out feeling bad, but then you'll get a pass on your step, or hopefully tomorrow you get a pass on your COMLEX, right? And that's all it is. At the end of the day, you're taking a pass-fail exam, and you just want to increase your chances of passing the exam. This is a big point right here too. Your board prep includes dealing with your testing anxiety, your lack of discipline, and fighting whatever skeletons you have in your closet. This was a big one that I didn't think would show up on my board prep, but testing anxiety is something that I've had for a long time. Going and talking to Dr. Webb, or a school counselor, or going and talking to your PCP about stuff like this, it's really helpful. Finding ways to test better, because you don't want external factors affecting your brain, right? You don't want to be able to have everything studied and then you go for an exam and then you get too anxious and you get everything wrong, right? You want to trust in your ability. So dealing with things that are not medicine or board exam directly related is also helpful for board prep. So dealing with your testing anxiety, if you have a lack of discipline, let's say that you're a person who didn't ever study for your MCAT, or you probably put in like, let's say 100 hours into studying for your MCAT, or you were very ignorant to how much work actually goes into being successful, like this is the time to get over that, because a pass-fail boards is your time to actually sit down, reflect, think about what you're doing, think about your commitments. Am I putting myself first? Or if you have other commitments, like how do I find a balance of priority, right? I was very privileged in the point where I like did not have to deal with anything other than school. Not a lot of people have that privilege. A lot of people have significant others, families, and stuff like that, I don't want to say get in the way, but complicate your priorities, right? So finding a balance between that, sitting down every couple of weeks and being like, hey, did I do enough this week? Did I feel like I was prioritizing my time well? Do I feel like I'm still on path to achieve my goals, right? And if you find yourself slipping, let's say you're going to like too many conferences, or you have 12 bachelor parties and 6 weddings planned for dedicated, like you're going to have to learn to say no. You're going to have to learn to just sit down and be okay with like the FOMO, right? Of just missing out on things, because these are very important exams. And I personally will say that I did not give a lot of respect to my MCAT. And I was really mad when I got those grades back, and I was like, how do I be better? How do I do better? And learning what I know now of like how to study, how to be disciplined, what goes into a proper proper practice for doing well on your exams. Now I know the amount of work that goes in, and I was like, all right, now I know that if I studied like half as much as I did for my board exams for my MCAT, I would have made like a 528 easily, right? And as we learn and grow, we come across these things, and kind of knowing that, let's say you still have some testing anxiety because you did bad on your MCATs and stuff like that, like dealing with those things, actually sitting down and focusing on what you need to focus on for that day, sticking to your schedule. Like you have to find these like non-negotiable topics and really stick with them, because that's how you be successful. And if you're always making excuses and stuff like that, you'll find yourself that you, one, push yourself off of your own timeline, and two, you'll be mad at yourself at the end of the day, right? Like you have a goal that you want to set for yourself, so achieving that goal should be the priority. If you have other things, finding the balance is your priority. And moving on, your problem isn't time, it's your focus. This goes back into the discipline thing. It is a completely different type of discipline, of commitment. You will have to say no to a lot of things, and for me, I studied a lot for it, and I felt good. I have the privilege right now. I have 8 weeks of summer. I took all my board exams. June 12th was my COMLEX, which is my last one, and I don't start until July 23rd. So I have 5 weeks, 5.5 weeks of just doing nothing, right? And I don't want to say that this is the right way to do it, but I would much rather have a summer where I can take 5 weeks off rather than kind of slow down, make my excuses and everything, and end up studying all the way till the week before you start clinicals or the week of clinicals, right? So getting a good break and all this stuff. So kind of find out what your priority is. There's no right answer. If you have other things you have to deal with and you LinkedIn it out, let's say you pass your first COMSAE or you don't, right? You have to be able to adapt your study schedule like that. And at the end of the day, you want to be peaked the day you take your exam. It's like a marathon where, I don't know if you guys have ever trained for a marathon, but I have a ton of friends that are like do Ironmans and marathons and stuff like that. And what they do is you'll never run a full marathon before your marathon, right? You'll always do your prep. You'll always work up for it. You'll always work on your pacing and stuff like that. You take a low day the day before, and then you go and perform. So you want to be at your peak physical capacity when you're running a marathon, the day of the marathon. You want to be at your peak, mental capacity, your educational perspective. You want to be the smartest you'll ever be the day you take your exam. So you want to study around that. You want to be able to peak the day you take your exams and stuff like that. So work out a schedule. I have some resources at the end of this thing of how to make a schedule. There's some cool resources that are very med school specific, and those help a lot. There's no perfect study plan. You're going to find all these clickbait videos on YouTube that are like, this is the perfect study plan. This is how to pass step 1 with 100% guarantee. There's no such thing. Don't fall for those titles. Don't waste your time watching those videos. chances are you'll find a little bit of extra information that you might not have known, but you won't get the time back that you would have gotten if you just studied instead, right? Instead of watching a 38-minute YouTube video on some guy explaining Anki over and over again. Like, there's just get the work done. And this way, I go into my next point, which is like, preparing to study does not equate to studying. Once you have a plan, just stick to it. You need to trust your instinct and trust your ability to prepare, and you need to stick to it, because it will take time and it will take consistency over several months before you start seeing the benefits of what you're doing. So I have a question that says, just to double check what you said for ClinMed and OMS2, we should use in-house material to succeed in in-house exams. Are there any other classes that fall into the same category? I want to say no. ClinMed really uses like diagnostic medicine to make your exam, and that's not what Step 1 covers. Step 1 and COMLEX Level 1 do not cover how to, like, the next best step questions. You know, like you get in MSK, it was always, do a chest x-ray first, do an x-ray first, do this first. This is not Step 1 content. And ClinMed really does a bad job of sticking to Step 1 content, where it really blurs the line. But it comes at an advantage, right? Because you come into clinicals and you know that you should get an x-ray always, right? So it has a benefit, but if your only goal is to pass your level 1 boards, 50 or 60% of it's useless information, right? But you still need to pass your exams, right? So you need to learn all that useless information just to pass your exams. But that's why I think that board prepping for your systems does not equate to board prepping for your in-house ClinMed exam. So you have to read those lectures, you have to go to lectures, you have to do all the practice questions, you have to do all that crap, because a lot of the information that's on ClinMed is not board relevant for level 1 boards. And then, well, when I took my first COMSAE, I had soon already completed all of your content review, and we're of course already doing practice questions, but you hadn't completed all your studying yet. Do you feel like you're well prepared to take the COMSAE? Do you feel like you were well prepared to take the COMSAE? I want to say the first COMSAE that I took, I went in with no expectations. I wanted to see where I was at, and I think I took my first COMSAE probably the first week of dedicated, just to see where I was, just to get used to the formatting. And I definitely hadn't completed all of my studying, and I don't think I'd reviewed all the systems at that point either. But if you look at your distribution and you're like, oh, my repro is really low, and you haven't studied repro yet, like, you know that, this is something that's going to get better with time. But when you're taking your COMSAEs, let's say you already board prep GI, renal, endocrine, I don't know, hemonc, right? Like, those are topics that should be in the average or above average, so you shouldn't be missing questions on those things. So whenever you see it presented on a COMSAE, you're like, oh, I did well on hemonc, but I sucked at GI. What do I need to do to get better at GI again? Because I haven't looked at it since block 5, right? So you go back, you look at your diverticulums, or you look at all your embryological abnormalities and stuff like that, and you're like, oh, okay, this is what it was. You get another pass of the content, which helps you answer the questions right next time. So for me, I took the first COMSAE, the in-house COMSAE. So the question was that she meant the in-house COMSAE, since we all need to pass that to be eligible to sit for the board exam. For my COMSAE, which was on May 27th, I was already done board prepping at that point. For me, I was really anxious about passing that exam for some reason, and I wanted to be not peaked, but like 90% peaked by the time I had taken that COMSAE. So getting a 460 is, I don't want to say easy, but it requires like 65% correct, and that's in all topics randomized. So you should be scoring around that. If you're missing one system, that's not going to take you to 65%, right? If you haven't studied repro at all, like, that's probably going to be like 15% of it. So, but you still should be passing your COMSAE, you know what I mean? But if you, I definitely recommend being board ready by the time you take your COMSAE, which is the in-house COMSAE, right? Because then you have 10 days, which is like a grace period of the time you pass your first COMSAE into when you're eligible to take your boards. And the way I did it was I took my COMSAE after a week, so 7 days, I took my step, and then 7 days after that I took my COMLEX. And May 27th was when we took our first COMSAE. The first eligible day to sit for your COMLEX was June 6th, which is the day I took my step. And then June 12th is when I took my COMLEX. So I didn't have a lot of time between those two things. It was probably a 2-week period, right, where I literally just reviewed topics that I missed and stuff like that and focused on my hard concepts on the COMSAE. So you should basically be done board prepping by the time you take that COMSAE. And I know the schedule looks a lot different for different people. There's some people in my class, that were like, hey, I'm going to fail the first COMSAE because in my schedule, I'm not going to be ready until the second COMSAE anyways, right? So they stick to their schedule and they go and pass the second COMSAE because that's what their goal was. They stuck to their plan and that's how they plan to do it. If they pass the first COMSAE, congrats on them. I know some people that were like, I'm going to fail the first COMSAE because I don't think I'll be board ready by the time the first COMSAE comes around. And those people passed. There's some people I know that passed the first COMSAE and they're like, wow. But then they stuck to their schedule, they stuck to their stuff, and they, still took their exams on time and still peaked. Because at the end of the day, the real board exam is what matters, right? Did that answer your question? Oh, I can't see that. Okay, cool. And then lastly, LearnR support system. This is a very hard time. You're going to be super emotional. You're going to be super out of everything. You're going to be studying all day. You're going to be tired. You're going to be, brain dead for most days. LearnR support system. Find friends. Find fun things to do during dedicated that, make you not think about studying. If you have a significant other or family nearby and stuff like that, use them to kind of help you decompress afterwards. And then I've got a few other things. Other tips, I'm going to be sharing this PowerPoint, but this is the checklist. Make sure you use a checklist to make sure you're hitting each resource in its entirety. This is the Debbie West drive. She has an entire, an Excel sheet of every Boards and Beyond video, an Excel sheet of every SketchyMicro, Sketchy Farm video, and you can check them off as you go. One thing that I used was the Anki Colorful Tags add-on. This is a paid add-on, and it basically lets you color your Anki tags, kind of like this. And this is what I use as my checklist. So in my Anki tags, I just would go by and, if I'd watched the whole chapter, it was blue. If I had watched half the chapter, it was orange. If I'd watched the video, it was green. And you just, you go back and forth. And that's how I used my checklist. I didn't use an Excel sheet or anything like that. And I just used this. So what else you can do, and if you want to email me, I'll send you the file for it. I believe that medical education should be the cheapest it ever is. We already paid too much in tuition. You should not be paying another X amount for other resources. I don't care. And then make a schedule. Cram Fighter is a really good resource. They have med school specific things where you can say that I want to use Pathoma, SketchyMicro, Sketchy Farm, and it'll pull out all the videos and you put your schedule in there of hey, I don't want to study much on let's say Monday nights and Thursday nights because I have exams on Tuesdays and Fridays, right? So it'll lessen your load there and it'll increase your load, let's say on the weekends. Or if you want to take Saturday off, it'll fix it all up. And let's say you want to be done by, end of block break 7. So it'll make it for you. It'll tell you the minimum amount of work you need to do. And it's a checklist thing. So you can go, I had this pinned on my Google Chrome and it was the first thing that showed up every day when I opened my Google Chrome. So I was like, all right, I need to watch 3 sketchy videos and 1 Pathoma video. And I, click them off as I go, and it gives you a little celebration confetti once you finish your thing for the day. And then last thing is find a study buddy. Accountability is huge. We have different strengths of people who are disciplined. We have different strengths of people who have different strengths and weaknesses in medical school. And finding a study buddy, finding someone to have accountability really elevates both of you guys. It's not going to slow you guys down, and it's a really good way to kind of constantly make yourself better. Bonus points if you both constantly work towards outperforming one another. I did that. Me and one of the guys in my class, we would basically take all of our practice exams and everything on the same day, and we would try to see who scored better. And that's what helped us. We were very competitive people, and finding who scored better versus who scored worse would make us work harder. And this is my information. I'm going to get into a little more personal stuff. This is like all of what I did. I put it at the end just because this is what worked for me. I gave a really unbiased view of everything beforehand. And so this is what I did. I took both Step 1 and Level 1. This is my testing timeline. So on the red text, these are all my Step 1 prep. I forgot to add my free 120, but I took it 1 week before my step, which was, if my step was 6/6, I think I took it on like the 31st or something like that of May. Highlighted blue are my OMS mandated exams. These are the ones that the school gives us that you have to take on those days. And then highlighted yellow is my COMSAE that I took below a 460. And then highlighted green is everything I took that was above a 460. So if you look here, I took my first uWorld assessment in February. Our dedicated doesn't start until like April. I think it's, I have these switched up, but I think 325 is our first day of block 8, and we have a TrueLearn assessment that day. So everything I took beforehand, so I took uWorld self-assessment 1 in February, this one in March, and I took my first NBME at the end of March just because I wanted to see where I was sitting and how I was doing. And that was basically the driver of how much I needed to study during dedicated. And I omitted my scores and everything like that just for personal reasons, but this is kind of the graph that you're gonna, or the table that you're gonna make. You're gonna put in your assessment, your percent correct score, your score output, and any other information that you have. So if you look here, TrueLearn Assessment 2, ComBank 2, ComBank 3, and TrueLearn Assessment 3 were mandated things from our school. And then COMSAE 113 was also that was our COMSAE, that the school mandated one that you have to pass to sit for the boards. So one of the things you won't see is my free 120, but I took it on the 31st, I think. And you won't see anything on 6/5 or 6/6. 6/5 was the day before my step 1, and 6/6 was the day of my step 1. So you don't want to be doing things the day before your step 1. You just want to chill, light review and stuff like that, and then you take your exam, right? So then after my step 1, I sat down and took like the rest of the WelCOM exams and took all those. For me, I only took NBME 30, 31, and 29. By this point, by 31, I was scoring really well on the step stuff, so I didn't feel like I needed to take the other NBME stuff. This will look very different based off of how well you're scoring, how low you're scoring, and how much of your board prep you've already done. So this first COMSAE I took on May 1st was my get used to the formatting COMSAE. So I don't think I'd done any neuro or cardio or respiratory at this point. So I took this, and it was below the passing standard of 460, but it wasn't super far back. Because again, if 65%, if you're missing a few things, like a few systems shouldn't equate to over 30% missed, right? So the ones that I knew, I did well on. So then you continue on. I took NVMe 29 just to make sure, because I had this little piece of anxiety of like, hey, what if I forgot everything from step? So I took the NVMe 29, and then I took COMSAE 110, which is a week out from my actual COMSAE that the school had. And I took this one, I scored really well on it, and I was like, all right, I feel confident going into my COMSAE. And just like I said earlier, you should be scoring or shooting for above a 460 on your COMSAEs that you're practicing on, so that you feel confident going into your actual COMSAE, which is the school mandated one. I think I probably scored 40 points, I think, higher on my COMSAE school mandated one, but I also had like about 10 or 11 days to add information that I had missed and stuff like that. So you're gonna follow basically, if you're doing it all right, mostly like a linear positive correlating on your like examinations and your percent correct for the most part. And then these WelCOM exams are 75 questions. I just sat down, I did them, and didn't take long, and that was like all my board prep was for that day. My Anki cards and then my WelCOM exams. And then lastly, this is what my board prep was by resource. You can use the checklist. This was my form of the checklist that I used. For Boards and Beyond, I used it for specifically physiology. So biochem, I just used that for vitamins. It was cardiophysiology and anatomy, endocrinology, physiology, GI, anatomy and physiology, MSK, anatomy and physiology, and then same things for these. Psych is a weird one because there's no like Pathoma chapter for psych. There's nothing on what's it called? Sketchy Micro and Farm are like specifically for psych. Like there's no psych bugs, right? Like not a thing. But there's like psych pharmacology. So I had to find another resource that really covered all the psych. So I watched all of the psych chapter for Boards and Beyond. And then just physiology. You can look that for Sketchy Micro, I watched every single video. I did every single card on these. For Sketchy Farm, same thing. I watched every single video for every single chapter and I did all the cards for it. For Pathoma, same idea for the most part. For vascular, I felt like I didn't need to watch the videos on hypertension, dissections, and tumors. And then same thing with thrombosis and embolism. So those are videos I just did not watch. I didn't take notes or anything on them. I like read through the chapter maybe a little bit, but I did the rest of these. Like I did the cards for these, I watched the videos, and I annotated the textbook, and I reviewed all my questions and stuff. So going through Pathoma, I used this resource exhausted, except for, a couple of these. Sketchy Micro, Sketchy Farm, I used every single resource for that. Like everything that's available for these videos. First aid, I literally just used it for public health. If you're a person who reads well off first aid, yours is going to look completely different than mine, right? And then OMM, there's the other deck, which is the Savarese or the Demeter deck, which is also an Anki hub. But I literally just I went through these cards. I found out like all the radial head stuff I was really bad at, all the fibular head stuff I was really bad at, all the like ulnar and radial arm stuff I was really bad at. So I really focused on upper extremities, lower extremities. The craniosacral motion is stuff you're going to learn in like 2 blocks or something like that. I was really bad at it. Finding an exhaustive resource for all the Chapman points, all the visceral somatics, which is facilitation, and then all of the counter strain points. Like I used this resource and it helped me a lot just because it's just stuff you have to memorize. I don't know how well versed you guys are, but none of it makes sense to me. And using it as a resource to just memorize and understand like what the correlations are, it helped a lot. You got a question?
Yeah, have you heard of the Dirty Medicine OMM deck? Or?
Yeah, so I use the Dirty Med videos a lot, and it really provided like a very, what's it called, like high yield view of everything. But I found that some of the questions that were on the Dirty Med OMM videos and decks and stuff like that didn't really cover like maybe 25% of what was also like tested on boards, stuff like that. So it was good for like understanding basic concepts and like kind of getting all your stuff together and finding some of the small correlations. Like for radial head, it's really good. For fibular head, it's really good. For craniosacral motion, it's really good, but it's not like exhaustive, So I got a lot of questions that were like, OMM questions that weren't on 30-minute OMM. So I did watch a few of those videos, and I will recommend that for topics that you just find super hard, Dirty Med is really good for that. Like ovarian tumors, I really sucked at. Testicular tumors, I really sucked at. Heart murmurs, I really, really sucked at. So watching the Dirty Med videos for those really helped a ton. And going through those and finding what works for me. And Dirty Med just was that weird resource that everything made sense to me after I watched that video. So I use it as a last resort, though.
But you recommend this deck over the Dirty Med deck?
Yeah, 100%. I think the Savarese one is a little better because it's exhaustive of the whole book, and that book is the one that's used for like OMT testing for the COMLEX.
Okay.
So I definitely recommend it. You won't do all the cards. I want to say it's like 1,000 cards. You won't do all of them. Like OMM basics, like you don't need to do cards on like Fryette's laws, or like which way the spinous process faces based off what thoracic vertebrae you're in, right? Like you don't need to do cards on that, but like some of your special tests, like what's the Ruse test, what's the Adson's test, what is the Aubert test for, and stuff like that. Like that's stuff that I found really useful. And like counter strain was huge, Chapman points was huge, and then facilitation was huge. And those are just like, what viscerosomatic is this? What Chapman point is this? And those are all like first order questions, right? There's no second or third order way to ask what is the Chapman point. It's always going to be like, this is the Chapman point, what is it? Or this is what it is, what's the Chapman point? There's no other way to ask these things, right? So they're very straightforward, and I definitely recommend going through this because it's comprehensive, and these are easy questions you shouldn't be missing, right? Same thing with pharmacology, same thing with microbiology. OMM, pharm, micro are questions you should just not be missing. By the time you're board prep for them, those are questions that you'll always get right. 95% plus. It's okay to miss a few of them because you'll see things presented in super weird ways, but on the actual boards, I don't think I missed many OMM, micro, or pharm questions. And these are my resources. That PDF that I posted that had like first aid as an A, Pathoma as an A+, they have this posted right here. It's the first aid team. They made this resource. It's like 15 pages long of like what resources are available and what they think about them. Like, how much they cost, what their rating is, like A, B, C, D, F for the most part. And then I think it's a good way to just know what's out there and what each resource is for. And then I have my Anki guide for OMS2s. This is the Google Doc. I'll post the YouTube link as well. I think the YouTube link is in this PowerPoint somewhere. And that's just basically, if you're going to use Anki for board prep, how to use it, when to use it, and how to optimize your Ankis. Anyone have any questions?
What was the name of the Savarese deck? You were calling it something else.
Oh, the Demeter deck. DEMETER. If you already have Anki Hub, it's just called OMM for COMLEX.
Okay.
Yeah, but I definitely recommend buying Anki Hub and using those decks because there's people that actively go in and update those decks every day. So
I have.
Yeah, so it should be the AnKing deck should be by AnKing Med, and then the OMM for COMLEX deck should be by JWill, and those are the two decks you need. If you're someone who doesn't want to spend all the money, you just put in $6, you download the decks, and then you just delete your subscription. Right? They're not gonna repo your decks from your offline database of Anki, right? So you won't have anything that like gets taken away. So if you don't want to pay the $6 subscription a month, I pay it just because I use the resource, every single day, and I pay the $6 a month, but you don't have to, right? And I definitely recommend it that way. Will you be posting the video? Yeah, I'm gonna post it on YouTube. I'll put in all the timestamps and everything, and then I'll post the link to the video in y'all's Discord. Welcome. Anyone else have any questions?
Yeah, quick question, Frank.
Yeah, man.
So you were talking about like making TrueLearn practice questions and stuff like that,
Yeah.
and you said that you did randomize like a little bit after Endo.
Yeah.
So how would you recommend like searching for questions? Like I usually just look for like kind of hot terms and just like look them up and add them, like just on the TrueLearn website.
Yeah.
Just because that's a like tedious thing to do is like trying to look up all the questions.
Can y'all see this on my screen? My whole screen?
Yes. Yep. Yep.
So going to TrueLearn, you go into here and this is my access to TrueLearn. That's funny. So you go into here and you'll go into create test and right here. So I already reset my thing, so it says my question pool is 2700. So you go here and you go to systems, right? And this is for non-random questions. This is for block specific. So you'll go here and let's say you want to do endocrine, right? So you go into endocrine system, you click the plus that's refined by discipline, and let's say you have an endocrine, histo exam, right? You go in and it says 4 questions available, but you'll have all the questions available and stuff like this. Right. And let's say you're doing histo and path, right? So histo path, that's 20 questions here, and you'll sit down and you'll do all 20 questions.
Okay.
And once you're done with that, they won't be available in your question pool anymore. So you'll be, you see there's 180 endocrine questions. There's 300 cardio questions. So you do like endo, you go into repro, and then you're like, all right, for repro, I want, let's say, anatomy repro, right? There you go. Or I want just pharmacology, or I just want microbiology. Or you can do it the other way, where I recommend it this way for, where is it? Oh yeah, so you just click all of them, and then you want to do all system microbiology, right? So this way, there's only 264 micro questions in the whole question pool, and when I said, you should be board prepped for micro and farm by end of block 7, that means watching all the videos and have done 264 questions for micro and have done 493 questions for farm.
Gotcha.
It seems like a lot, but you will be flying through questions. You'll be doing upwards of like 100 a day by the time you're like at the end of your board prep stuff. So if you split 264 over what is 3 blocks, like 5, 6, 7, that's like what? 9 months. That's like a question a day. That's not even a question a day. Yeah. So doing it that way, like you kind of get used to how things are supposed to be done, and you kind of figure out what is high yield as you're doing the videos as well.
Gotcha.
uWorld is a little better. I don't have access to uWorld anymore because mine expired, but they will let you like super stratify your stuff into like very specific topics. So like, how this goes into microbiology, it'll give another stratification point where you can go into like, I just want to talk about micro like risk factors or micro bugs or just micro treatments and stuff like that. So whenever you're going into your next system, let's say you go into GI and you're like, all right, GI anatomy exam's coming. I'm going to do all the GI anatomy questions. There's 288, but you'll have done most of them already. It's all of anatomy, right? So GI anatomy is, I think, 2 exams or 3 exams. I can't remember. And you're doing 288 questions over, 5 or 6 weeks, and this is your testing resource of it. So this is like your third pass for GI anatomy. And then you're like, all right, I'm done with that. I'm going to go into cell biology, which is like biochemistry, genetics, and then where is it? Oh, they don't have the general. Oh, yeah. Asymptomatic. I don't remember which one the cell bio one was. Oh, yeah, there you go. So you go into GI, and you're like, all right, I just want to learn the... Oh. I think those ones show up in the general one then. I can't remember now. But if you go into here, you're just like, I want to do all of GI, and then you like do all of this. Your asymptomatic and general ones will show up in here. So like, what is like cell biology, the physiology of GI and stuff like that. I think most of it shows up in biochemistry, genetics, and molecular biology. But there's like some other random ones that will show up. And then like also making time to do like the ethics questions, the jurisprudence questions, the OMM questions, and stuff like that during your, like the PrevMed questions. I think you guys are done with PrevMed, if I'm not mistaken. But doing the PrevMed questions on these are also helpful.
Gotcha.
Yeah.
So when you're doing this during the block, you're not concerned if you've seen that material or learned it through the school or not yet, because you can't refine it further than that.
Right. So
Okay.
I will sit down and just do all the questions. One thing I was doing during the block that I didn't find helpful was like, I would open up like 100 question thing and only do questions off stuff I've already seen. So like, let's say I make a 100 question list, and I get to one question that I haven't seen, I just skipped it. And I didn't find that super helpful because at the end of it, you're going to have to know it all anyways.
Right.
And it really does slow down your second year. Like you won't be... It doesn't feel like first year anymore. Like, where you had like 15 or 16 topics and you were just cramming all the time. Like, it doesn't feel like that anymore. You'll have time to sit down and learn other things because they know that you're also going to be board prepping. And GI, for the most part, is a chill system. Renal gets really iffy on the physiology. And then like endo repro are like either hit or miss, right? So you'll have a lot of time during your second year to be doing all this. It doesn't feel like first year anymore. First year was really like cram everything, hit everything. We're going to give it to you whether it's board relevant or not. Here, they really like refined everything.
So can I ask, with our schedule, like we have the 70-30, so how did you, like, I guess off the record, I don't know, how did you balance like going to class, air quotes, and then also like board studying?
Yeah, so for me, I did not pay attention in lecture at all. I sat in the front corner, and I think I had headphones in like all the time. Or I just like didn't go to class, or I was, if we didn't have the SGA president sitting here,
I'm a big proponent for not going to
I would
class.
sit in the study room and check in, or I would sit at home and spoof my location.
Okay,
Off the
perfect. Because that's what I was.
Do that.
I don't believe in the 70-30.
Yeah.
And I believe
okay.
if you're scoring well, they don't care either. So
Okay. But ClinMed, you said you'd pay attention.
yeah, so I either went to class or like I watched the lectures afterwards. Sometimes when we have guest lectures, they talk really, really slow.
Yeah.
So watching those on like 5x speed was like really nice for me.
Okay, bet. Thank you.
Yep. Any other questions before I close this thing out?
This has been great, man. We really appreciate you doing this for us.
Yeah, man, anything to help y'all out. I really felt privileged in the position that I was in to like, stick to my plan, do all the work, and get like the success out of it that, it worked and I could help other people do it. Because I know it's really confusing. We're sitting for our boards for like the first time ever, right? And people who like didn't have strong study strategies beforehand, or like barely made it out of OMS 1, like really struggling for it, like need more direction, and the school doesn't give it to you. So having this direction, having it recorded, and being able to, look back on it multiple times can kind of solidify a study plan and kind of guide you in your process. So yeah, well, thank you everyone for coming. Hopefully this was helpful, and I will post this PowerPoint, and I will let you guys know when I've processed the recording and post it on YouTube.
Cool. Thanks, bro.